Well, looks like we're live. Thanks everybody for coming. Welcome to the Cadaver Lab, or the Institute of Human Anatomy. For those of you who don't know me, my name is Jonathan Benyon, one of the teachers here, and just a lover of anatomical awesomeness. So we are going to do a couple of things today. I'm pretty excited about it. One, we've had a lot of feedback and a lot of comments on our female reproductive series, so we want to address some of the topics in that. Some interesting questions in our comments that I already want to address, and we will also take your questions about that stuff as we go through the live stream. Now, it looks like I'm getting sound here, so if you guys have any issues with the sounds, let us know in the comments. I know Jeremy and Justin are behind the scenes. They're going to help possibly moderate some comments as well. We get a lot of questions, and so we're going to try to address as many as we can. For those of you who are interested in cadaver dissection, or at least a view of the cadaver dissection, we'll do that at the end. Actually, we're going to go kind of in reverse order today because I'll have to set some stuff up and put that little black screen back up again where it's a countdown, where I'll get the cameras adjusted for those scenes or those anatomical structures. So a couple of things that I want to start with, and then we'll get to your guys' questions, is we had a lot of fun doing the female reproductive series videos. We've only dropped 2 so far. We've done period cramps and we've done ovulation. The next one's going to drop next week on Tuesday, I believe, and that's going to take care of fertilization. And then our 4th video wraps everything up, kind of putting all 3 of those topics together to kind of view them together. When I was a student, it was kind of nice to jump back and put each one of those concepts together to help learn those topics. But some interesting comments that we had. One that I want to talk about with the female reproductive series was this comment of men teaching about female reproductive system or reproductive anatomy or physiology. There was a lot of fun, interesting comments that people come on, and I think a lot of people do it in fun, like in jest and kind of joking around, like a dude teaching about female reproductive structures and period cramps, how dare they? And so I think it actually brings up a really good discussion to talk about that, because should a man or a male be able to talk about things that he's not equipped with? And the first thing that came to my mind when I thought about that was, does that mean that we couldn't have a female teacher teach about, say, like a testicular torsion or prostatitis or epididymitis? And I immediately was like, no way, that's totally fine with me. A female could totally teach those things. And I was taught by multiple female instructors through my medical training that taught about male-only disorders and male-only anatomy. My anatomy professor when I was in my medical training was actually a woman. And so I think it's an interesting concept to talk about, because I think women, in a way, and rightfully so, kind of get protective of that monthly visit that they get all of the time. And I think to teach about male and female anatomy is not necessarily to be like, oh, I know exactly what you're feeling. It's more of, this is why this happens. This is the relevant anatomy and physiology. And I've always felt that anybody, regardless of male, female, or whatever, equipped with testes, ovaries, uterus, what have you, if they know the stuff, I'm all ears. And so that was kind of an interesting thing, and people discussed that in our comments, and I thought it would be something to bring up during our live stream and address that, for kind of this thing about something that affects women on a typical monthly basis. And I've had other men almost a little bit scared. I've had other male teachers be like, I don't know if I should teach about that. Am I going to get flamed for teaching about female reproductive anatomy? And I just say, go for it. Go for it. If you know your stuff, if you studied, if you can teach it in a fun, respectful way, that's all we can ask for. So that's kind of my 2 cents on that topic that we got in the comments a lot. And really it is. It's not something that's fun to deal with women. Obviously, I can't empathize exactly. I think I can sympathize with pain. I think all men and everybody can sympathize. And this is going to tangent me a little bit on clinical stuff. Like when I go into a room with a patient and they're explaining how much pain they're in, I always feel like it's really important for me to go in with a clean slate, no predetermined notions or no judgment about oh, they're not really in that much pain, or they're being a wuss, or they're being a baby. And believe me, I'll be honest, it's challenging. At the very end of a shift, somebody comes in like right before we're about to close in the urgent care, and they've had back pain for like 3 months, and they decide to come in at 8:55 when we're closing at 9. You have to like really challenge yourself to be like, okay, clean slate, here we go. Let's respect their pain, what they're going through, and even with women. So, and I'm sure you guys are getting a lot of, I haven't been able to see the questions yet. I'll definitely get to those. So I like that topic. And if you guys have comments in there that you want to address, we'll get to those in a second. One other thing that I felt was really interesting in those comments, have you guys ever seen those videos where they're like, men will never experience the pain that women go through with period cramps or labor? And I still say to this day, you're absolutely right. There's no simulation for that. That is something that men will not be able to exactly experience. But then you see these YouTube videos of like dudes getting these TENS devices or these electronic stimulators placed on their abdomen, and they turn them on full bore, and the men are like on the ground rolling and writhing and like in pain. And I feel like someone were like, see, that's what it feels like. And the reality is it's not. It's not. And I use this to not again diminish what women go through. It's actually to build it up. Like that can't simulate period cramps or labor contractions, because when you put TENS units or electronic stimulators on the abdomen, that stimulates a certain pain pathway called somatic pain, which is pain that's more like surface anatomy. If you put those same electrodes on a woman, she would feel very similar pain that the man was experiencing, and I guarantee the women would say this is still different than uterine pain or uterine contractions, because the uterus is an organ and that goes through visceral pain pathways. They're different pain pathways, and visceral pain pathways are not quite as pinpoint accurate. Like when you poke your skin, that's somatic pain, and you can get poked and immediately feel exactly where it is. Visceral pain is not quite as pinpoint accurate, and it's sort of the reason why we also feel referred pain. Like, for example, some women, when they have period cramps, it radiates to the back or radiates to other areas, and that's because it's this visceral type of pain that doesn't go through the same pathways. So I like to bring that topic up just because even if you put these, like I said, the electronic stimulators on a man or a woman, it's not going to simulate the same type of pain pathways as uterine contractions. So again, that's been a really fun series. I hope you guys have been enjoying those. If you haven't seen them, check them out because some more videos are coming. But I want to just jump right into getting some of your guys' questions. And like I said, for those of you who want to stick around towards the end, I will put the black screen back up when I get the cadaver ready, and you can take a look at a uterus and the broad ligament of the uterus, the uterine tube, etc. So let's take a look at some of these questions. I know there's a lot of you on here, and a lot of people have some questions that they're going to go through. And so we'll go through those as we go and just attack this live session. So this is from the guy. What can you tell me about the digestive system? I can tell you that it's a very complex system. It's a pretty broad question. We do have a reproductive, I'm sorry, not a reproductive, we do have that. We have a digestive system video where we go over the overview. I would suggest looking at that video. That'll give you more information than I can give you in a quick answer here. And then when you get more questions from that, if you post some comments, we can address those or come into our next live stream with some questions. But that's a pretty good question as far as, I mean, it's a pretty broad question, but there's a lot of cool things about the digestive system. I'm planning to do a stomach anatomy video here soon, so I'll be focusing a lot on that in this next coming week or so, and we'll post some videos on that. This is something we need to talk about for sure. This one right here. Hope Z, are you ever going to do videos about the male reproductive system? Absolutely. We're going to be doing that soon. Justin and I have been talking about that. For those of you who don't know Justin and you haven't seen our TikTok channel, Justin does a ton of TikTok videos, awesome informative videos, and we're going to be doing those. We're going to be kind of complementing this female reproductive series with the male reproductive series, because you gotta need two to make life or a baby. And we're just also doing some dissections to get those videos ready, because you guys one of the things that we love doing is always bringing things back to anatomy. Hence, we're called the Institute of Human Anatomy. And so we got to get those dissections ready for the male reproductive system. A lot of supportive comments. Thanks, you guys. We really appreciate that you like the videos. I get this question a lot, so I'll just answer it now. Sandra said, "Hi, Jonathan. Are you a doctor?" Not technically. So I'll give you guys a little bit of my background. I went to the University of Utah for my undergraduate program, and I took an anatomy class. And the reason I took anatomy is because I was doing pre-med. I joke around and I always say that everybody's pre-med at one point in their lives. And I was trying to do my pre-medical education, took the anatomy class, and I fell in love with the human body. It was amazing. I still remember to this day, it was like yesterday. So this is back in 2007 when the teaching assistant in the anatomy lab handed me a human heart. I remember just grabbing it and looking at it. I'm like, I had that one split second of, this is a human heart. And then I was all in. I just went in. I never had that moment of being weirded out really by a cadaver lab. And everybody's different with their experience in a cadaver lab. And mine was just that one moment of like, I'm all in, let's do this. And so I was fortunate enough to score high enough in that class to be asked to be a teaching assistant. And so then how they run the labs up there is they let the teaching assistants essentially run the labs and teach the students. And I got training on cadavers. I had a key to the cadaver lab. I got to do dissections, and I just loved it. So I got distracted a little bit with teaching and ended up going and teaching at a massage school after I got my bachelor's degree. And I'm not a massage therapist, just a geeky anatomy teacher. And so the massage students went up to the cadaver lab. People are surprised with how much anatomy some of these massage students learn, and we would take them up to the cadaver labs. And then that relationship got fizzled, and I'm going into an origin story here. Sorry, you guys are getting the origin story of the Institute of Human Anatomy. So I was originally taking those massage students up to the cadaver labs at the university, and then the relationship between the two schools fizzled. And so the students were like in this uprising. It was hilarious. They were like on the border of like getting picket signs and being like, "We want cadavers! We want cadavers!" And like they would ask me for a year, "Can you get us to a lab? Can you get us to a lab?" And one day I was sitting at my house in the bathroom, because that's where all good ideas come from, and I was like, maybe I should start my own cadaver lab. And so I called my brother-in-law. His name's Jeremy. I've mentioned him in a couple of videos. He's probably helping moderate and looking through this stuff right now. And he's a brilliant business guy. And so I said, I want to start a cadaver lab. And I remember the conversation so perfectly, because he is really busy. And maybe I'm giving you guys too much information, but too bad. He's really busy. And so sometimes when you get on the phone with him, he talks really fast. And so there were times that I would purposely talk slower just because that's what I should do. And so I remember being on the bus. I was riding to work, and he's like, "Hello." I'm like, "Hi, Jeremy." And he says, "Hi, Jonathan, what's going on?" I'm like, "I have an idea." And he's like, "Okay, what's your idea?" And I said, "I want to start a cadaver lab." And just pause on the other end of the phone. And this is what I get from him. It's a pause, and then I'm intrigued. And that's when it all spawned. He started getting involved with information about how we would start it, because they don't just give bodies to anybody off the street. I had 5-6 years of experience with the cadaver lab at the University of Utah. We started to get involved with all these fun things, and that's probably too much to get into during this live stream, but that's kind of how we initially started, because of this lack of access to cadavers. And I think that's why people like yourselves and YouTube and people follow us, because you want to learn anatomy, and there's cool books, there's cool graphics, there's things we're going to be doing reviews on in the future as far as software programs, and I think they're all great and supplemental, but there is no replacement for the actual real deal. And so, sorry, coming full circle now. So I got distracted with all this. We started the Institute of Human Anatomy, and I still want to work with patients. And instead of going into the MD route, I went the PA route. PA stands for physician assistant. Some of us hate the name, but at the end of the day, it really doesn't change our practice. I'm glutton for punishment, because I'm in the process of looking into going to a DMS program, which is a doctorate of medical science. And so that's the next step that I hope to be starting in the next couple of months. And so I guess in a way there will be a doctorate degree attached. It'll be a DMS rather than an MD or like a DO. And a lot of people do the routes differently. But I love what I do. I work in the urgent care, help patients, but then I also get to kind of still mate with keep the first love, which is teaching anatomy. So that was a very long-winded answer. But I think Justin and I were talking yesterday about how many people ask us about our journey to this point and how seeing this has helped people to think about certain career paths. And I think that is one of the greatest comments that we get. We love to hear about influencing people to do things that maybe they were scared to do and now they're not scared to do. And there's so many applications to human anatomy and physiology. I can tie it into almost every topic if you really make me try, but so many professions need anatomy and physiology. And so I think we'll be doing some videos on pre-medical education, because the PA pre-medical education is very similar to the MD or DO, even nurse practitioner routes. There's a lot of similarities. And so I think Justin and I will do some videos on those things that you can do to get to that point, tips, study tips, all that stuff. So sorry, that was a long-winded answer, but let's continue on here. Oh, I just had to comment on this one. Werner Boshoff, I wish I was smart enough to study anatomy. This is so interesting. I want to bring this up because I've been teaching since 2007 now, so that's 13 years now, 14 years. And I truly believe, I'm looking into the camera saying this, that everyone can learn anatomy. I think you just have to, it sounds cheesy, but you kind of have to believe in it and you have to work at it. And it's a topic that everyone can learn. I have had blind students, people who can't see. Anatomy is a visual topic. Get A's in anatomy because they just worked as hard as they could. And I do think it helps if you have a good teacher, and that's what we hope to do here. We hope to provide supplemental education or ways for you guys to learn anatomy. I think good teachers make the learning process more efficient and inspire people, and I think they can help people to be more effective and efficient in their learning. So that's my 2 cents on that. I obviously have some strong feelings about what I believe people can accomplish with this stuff. So keep at it, and if you have questions, let us know. Here's a good question as well. So, why does an ectopic pregnancy occur? We're going to do a video on this soon, actually. We have so many videos we have to do, but we love doing this. But I want to give you a little teaser on this. An ectopic pregnancy occurs because the egg that was ovulated, and if you haven't watched our videos on this, again, go look at the ovulation video if you can. The eggs that ovulated, it gets fertilized typically in the uterine tube. That's normal. But what happens typically is that fertilized egg will descend down the uterine tube, also known as the fallopian tube. I don't love calling it the fallopian tube. Our next video will get into that. And then it should go into the uterus and implant. With an ectopic pregnancy, it implants in a place that it's not supposed to, and we don't always know why. Sometimes there's risk factors, but if that ectopic pregnancy implants in the uterine tube, that's not a good place to implant. That's not the uterus. It's not designed to sustain the development of a fetus or an embryo. And that's kind of your teaser version there. And we're going to get into risk factors for it in our video. We're going to talk about how you can, some of the symptoms that relate to ectopic pregnancies. When we have women come into the urgent care clinic and they talk about spotting or pelvic pain and they tell me, oh, I just got a positive pregnancy test, or sometimes we'll find out that they're pregnant in the clinic, that does have to go on the radar as a differential diagnosis to be like, do we have a potential for an ectopic pregnancy where we need to get imaging and confirm this, or is it kind of normal spotting that can happen during the initial stages of pregnancy? James Wayne has a question where he says, I've read that sperm counts in men have gone down. Has something similar been happening with women and ovum production? James, I haven't heard that at this point, and there's a lot of information that gets thrown around the internet. I mean, just with what's been going on with COVID, how many pieces of information have you guys got thrown at you that you don't know if it's true or not? But I personally have not come across that. I haven't heard it with OB-GYN partners that I've, other providers that I've worked with or sent people to. But I will look into it. And that's one thing I can kind of jump back on the teacher soapbox is one of the things that we learned as teachers, or at least when I was trained by my mentor in teaching, is if you don't know something, you better dang well admit it, because otherwise your students are going to lose trust if you make something up and it's wrong. And so I haven't heard that. I'll look into it and see if I can find any information on that. I feel that usually if something that I guess that big would come up, I would have heard of it by now just because of being involved in anatomy and physiology and in the medical world. But again, I'll do a little bit of digging on that and see if I can see if there's anything that's true or has any merit with that. So it's a good question. This is an interesting one. So, Sandra, not sure if anyone has asked this, but I am 52 years old and I'm still on my period faithfully every month. When will this stop? Help. Unfortunately, nobody knows for sure. Sorry, I don't laugh to minimize what you're going through. It's more of one of my least favorite things to answer to patients or people in anatomy are the unknowns. When you talk about when people go through menopause, you have the averages. We've accumulated all this data of like, this is the average time frame of the female reproductive cycle or the female reproductive years. This is about the average time frame that women will go into menopause. And you have those outliers or those people who jump kind of are outside of the average, where some go into menopause later and some go into earlier than normal. And then you've got everyone where they're kind of in that bell curve of the normal. And unfortunately, it's hard to say, hey, you're going to go into menopause, in 2021 on March 15th. It's one of those things that unfortunately nobody could tell you with any certainty. And I feel like if anybody told you with any certainty, they would not be telling you the truth. Unless there was some abnormality in the hormones. I don't know if you've been to your doctor or had any hormone levels drawn or anything like that. Those could be some things, but if it's the same normal period and there's nothing really abnormal about it, you're just probably one of those outliers that is going to hit menopause later than normal. How a miscarriage happens, again, these are hard questions to give definitive on all of them, but miscarriages can happen from multiple reasons. One that we talk about in the next video, I think it is, or is it the fourth video, is that kind of this one's failure of implantation. For whatever reason, it just doesn't adhere to the inside lining of the uterus. And in that case, you usually don't really know. Most people wouldn't even know that they miscarried. Other types of miscarriages is if there was a hormone imbalance, for example, could cause this. I mentioned this, I think it's the third video, where like if estrogen and progesterone levels for whatever reason didn't stay high enough, we're going to learn that the reason you get a period is because at the end of the cycle, the estrogen and progesterone levels go down, and that kind of signals to the pituitary gland to restart the menstrual cycle, and then the uterine lining sloughs off. And so if anything causes that to happen after an embryo is tried to implant into the uterus, the last thing you want to happen is uterine contractions that would slough off the embryo that's tried to implant there. There's multiple reasons to do that, and that's one of the reasons that you see that would be kind of like this spontaneous miscarriage that you'd have. And so that's one answer we'll give you. And I know I keep saying this because sometimes I have to skip certain questions, you guys, and I apologize for that because they'll take probably 10 minutes to give you an in-depth answer. And, I did hesitate on this one just because can we give you a good enough answer by just giving you one way that you could have a miscarriage? And so let me just kind of summarize what our plan is, because this has stimulated a lot of questions and we love them. We really do. It does take us some time, though. We have a lot of requests for videos for PCOS. And so we are going to do that. So people who have questions on PCOS, if they're a simple question on this live stream and I see them, I'll answer them. But if they're more in-depth questions, I will kind of defer to that video that we're going to do on PCOS. We're going to do birth control methods, contraceptive methods. We even had a suggestion of trying to maybe show where the IUD would go on our sagittal section of the uterus on one of our cadavers. So we may try to do that. And we'll do ectopic pregnancies. We're also going to do miscarriages and then even male reproductive system as well. So Unicorn Horn 96, I got a question. How come my periods got a lot more painful after my C-section nearly 4 years ago? One of the things that first thing that came to mind is potential scar tissue. The uterus has is amazing ability to heal and adapt. I mean, when you think about this uterus, the size of the uterus when it's not pregnant or does not have a baby developing in there is a very small structure that could fit in my hands right here. And then the development of how big it grows to accommodate for a fetus is quite remarkable. And so one of the things that I think of, you're literally cutting inside, cutting into the abdominal cavity, cutting into the uterus. There could be potential scar tissue that complicates the cramps, makes them more painful. And, that would be my best guess. I think most clinicians would be guessing at best, or having an educated guess about why that could occur. But to me, I think you're kind of dealing with, I cut inside, I opened up my abdominal cavity. There could be little adhesions around the uterus, which are little pieces of scar tissue that could make the contractions maybe a little bit more painful, cause this a little bit more intensity for that to occur after literally having it cut open. Avon, how does a heart work? In general, the heart works because of, how do you simplify this in a quick little answer here? Well, the heart is unique in that it has its own electrical system. If you've ever looked into the heart's electrical system, you have what's called an AV node, an SA node, an AV node, and that's this electrical system that sends its own electrical current to the heart. But you also have other centers from the brain, nerves coming down, that are going to also increase and decrease heart rate. Video that I'm going to post tomorrow on Instagram shows the blood supply to the heart. So the heart also needs its own blood supply to pump. These coronary arteries deliver blood to the heart muscle itself. And so that's pretty important as well. Can mood swings be always irrespective of the ovulation? Sandra, I'm wondering if I'm understanding your question correctly. I'm wondering if you're talking about, can mood swings be influenced by ovulation? And if that's what you're asking, absolutely. Hormones are powerful things, and it's not just for women, but in one of our videos, the fourth video for sure, we're going to show those spikes. I mean, literally, women have a spike that spikes in the middle of the reproductive cycle and then goes down. Not only is it estrogen spiking, and then you get followed by progesterone, you have follicle stimulating hormone and luteinizing hormones spiking like crazy. And we talk about hormones. You hear a lot about estrogen and testosterone a lot, especially when you're comparing men versus women. And what they do, they obviously are involved in production of gametes, which we mentioned, which is the ovum, the egg, all that stuff. They're involved in general reproduction, but they're also involved in creating what we call secondary sex characteristics. Primary sex characteristics are the presence of, say, like penis, testes for men, women like vagina, ovaries, uterus, and those actual physical structures. Secondary sex characteristics are characteristics such as jawline. Testosterone influences, I mean, this is how crazy, how powerful these hormones are, like creates more of a square jaw in men. Women, it creates more of a round face. Testosterone versus estrogen. Estrogen tends to have smoother, softer skin, or at least influence that in women, and thicker, hairier skin in men for testosterone. And these are kind of these simplistic generalizations there. And you can get outliers where maybe a female has more testosterone than the average female and might develop some thicker hair on the face, or vice versa with men, have less testosterone and have more quote unquote feminine characteristics than, say, the average. We're going with kind of the typical averages in both of the sexes there. But what's interesting about that is they also influence behavior. I always love going over this in my lectures with students because, when you're kind of talking about typical male and female qualities, you always talk about, like, I remember going to basketball games and a lot of our girlfriends would come and support us, and they would always just shake their head because, like, us guys in the middle of a game are like getting mad at each other. We're like pushing each other, yelling at each other and pounding our chest, and then like we want to fight, and then after the game we're like all best friends, and it's really kind of funny. And the girls would always be like, we just don't get you guys and your testosterone. I want to beat your chest and scream at each other and blah 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 blah. And so we always laughed. I remember like looking at them like, do you think we understand why you spontaneously combust into tears at times? Like, it goes both ways, and I don't mean to offend anybody like that. It's just kind of those like male-female sex characteristics or influence of behavior. But in a way, I always talk about them, testosterone does influence this aggression in a way, and we're no longer these hunter-gatherers like with our clubs and, running around our loincloths, pounding our chests like to protect, what's ours. It probably made sense from an evolutionary standpoint to inject testosterone into the male, like the bigger, stronger, and that's just a fact. I feel like I always have to tread a little lightly these days, but the fact of the matter is, men have bigger, stronger bodies, and women have different structures in the body, obviously, to have strength. Like, I guess you could say to carry a child and things of that nature. That's just science. That's just biology, and it might make sense to put a hormone in men that creates a little bit of aggression, that says, no, you're not going to come steal my food. Again, we're going with hunter-gatherers here, or deal or try to do anything with my family or hurt my family or whatever tribe or cave group you were in back in the day. Well, not us, but you get what I mean. And where estrogen tends to have other influential behaviors for women as well. And so I definitely feel for women. I know I'm explaining this because I got on a little tangent with it, that could be challenging in a way. It's not the end all be all to be like, for me to like make an excuse, oh, it was my testosterone, I had no control over that behavior. That's just ridiculous. It's not what I'm getting at. But it is an influence. To have this spike of estrogen right around ovulation, that could influence behavior. Is it the end all be all? No, but it can influence that. And then you have it spike down at the end, which is right before a period, which no wonder you're dealing with changes in emotion like PMS or anything like that. And that's a real thing, because all of a sudden the hormones just go down. And so that's a lot of what's blamed for premenstrual syndrome or those types of mood swings or anything like that. If hormones are swinging, why couldn't that influence swings in mood as well? Sorry, that was a really long explanation, but hopefully that gave you some answers there. Is it really PCOS Awareness Month? Okay. Because of that, if that's true, I have no reason not to believe that it's true. I think Justin and I need to talk, and we'll get a PCOS video in the works ASAP. We'll kind of boost it to the front of the list because we've talked about it multiple times, and if that's the case, I say we go with PCOS Awareness Month, and we'll get that there. And I apologize that I'm not going to answer the question right now, but I'm going to direct a lot of our energy into getting a PCOS video done. So this question I can answer a little bit of. It says Mary 13E13, what are the disadvantages of stopping the periods for a long time by taking hormones? So I guess it kind of depends as far as, most women say, like, if you were on the Mirena, which is a IUD birth control that releases a low-level amount of hormones, typically you don't get a ton of long-term side effects, at least what we know of right now. I always say birth control is a challenging thing to go with, and we will again address this in more detail, but I think it's a challenging thing to deal with because when you look at biology, what was one of the main goals of biology? This whole goal of biology was reproduce your species. And for bazillions of years, this whole process of evolving humans and other animals was like, we need to nail down this reproduction thing so our species can continue. And then we're like, nope, we're going to stop this right now with birth control. And the body's like, what are you doing? I'm trying to reproduce here. And so it's kind of ironic to me that biology spent so much of its effort to get to having effective reproduction, and then we try to put the kibosh on it. And so the reason I bring that up is there's no wonder there's side effects. And most of the side effects, luckily, are typically short-term. That's why I always tell women that there sometimes will be some experimentation with birth controls, especially hormonal birth controls, and sometimes you won't like one because of how it makes you feel, and not every female is the same in that case. And so that's why I always mention, again, some experimentation so that you can be like, okay, I don't like this one, how it made me feel, I'm going to try this one. That's why I personally like the IUDs. And again, I can say personally with a big asterisk by it because I haven't had an IUD, obviously. But the reason I like the IUDs is because they're less systemic, if that makes sense. It's more a localized release. Yeah, some can get into the bloodstream of the hormone that's in the moranum. I mean, if you do the copper IUD, then there's no hormones there, but that one causes more period cramps in most people. But the hormone IUDs are less systemic than a pill. You put a pill in, you swallow it, it gets into your bloodstream. That hormone can go anywhere and everywhere throughout your blood. So it tends to have more systemic side effects. Again, not perfect. Some women don't like the IUD either. But from just kind of anecdotally from the reports I've had from women in the clinic, they tend to, if I had to pick one that tends to be the most well-liked, those IUDs are pretty high on the list. So, I was going to mention one other thing with that. One of the things of stopping a period another way that can have long-term effects is if you're doing it with a pill, that's a different thing because you're supplementing hormones. But for example, if you were a really extreme athlete, this happens a lot with women athletes where they start to lose so much body fat that their periods stop. And if your periods stop, then you start to lose some protection that estrogen provides for your bones. And that can make women more at risk for decreased bone density. It can make them more at risk for osteoporosis. And so that type of stopping your period is a little bit different than, say, period stopping through birth control and things of that nature. And so it's really challenging and really frustrating to some female athletes because they're not necessarily trying all the time to stop their period or to lose so much adipose tissue. A lot of women, it's a natural side effect because they're so active. They just burn so many calories that they lose adipose tissue because they're so involved in their sport that it just starts to go away. And there's not like this set body fat percentage. Again, there's variation in women. It's not like 12.25% of body fat, every female is going to stop their period. No, there's variation when some women will stop their period with a certain body fat percentage. Again, it's kind of this evolutionary protective thing. And Justin, let me just do a little side note. I know I tangent a little bit. Justin and I talk a lot about this with evolution. And when you get on these platforms and you talk about these things that can be a little controversial, there's some people who really don't like when you talk about evolution. There's some people who really like it. So I prefer that people don't flame each other in our comments. This is just me trying to keep the peace here. That you can have separate ideas of evolution versus religious beliefs and stuff like that. When we talk about this, we talk about kind of these are the evolutionary theories. And when we talk about an evolutionary theory, we're not trying to crap down on a religious theory. I'm going to share my own personal opinion, and you don't have to agree with it or not. I do not think they have to be mutually exclusive. I think that because if evolution exists, it doesn't mean religion doesn't exist or things of that nature and vice versa. So anyway, where was I tangenting from that? That was from, I totally lost my train of thought on that whole big tangent of evolution. Oh, I remember. Yeah. So evolution, I brought up kind of a body fat percentage. When a woman loses so much body fat percentage, the period stops. I always tell my students, I'm like, it's kind of this fail-safe. It's almost the female body saying, hey, I don't trust you to have a baby right now because we don't have enough body fat reserves. And in 2020, that's not necessarily as big of a deal because we're going to get food and nutrients. But thousands of years ago, when we didn't have a refrigerator, we didn't have this, McDonald's, I don't know why I brought up McDonald's, healthy food that we could partake of all of the time, that the body needed a certain body fat percentage because it didn't know when its next meal was going to be, especially with women. It was kind of like, we got to have X amount of body fat to have a baby because I don't know when the next meal is going to be. So I always found that very, very interesting. Oh, this is going to be fun. Since we love these controversial topics. On that topic, so Marcel, where is that? Marciela Dan. I'm going to get to this question first here, and then we're going to do one here real quick. So let me bring that back up because that jumped off the screen really quick here. So on that topic, do you think that testicular pain is less than, I'm guessing that it's going to say uterine pain. I know it's only an opinion since you are a male, but we're allowed to have opinions. I do believe that everybody is allowed to have an opinion. I just, with how everything is these days, it's mind-blowing to me that we can't allow people to have their opinions and still respect them and let them speak and listen, and then you speak and listen. And our communication skills in 2020 have gone down the tube. That's a whole other topic. But, so, this is a really interesting topic, and again, not to offend anybody. Let me just say it this way, there are women that have experienced worse pain than uterine cramps or period cramps. They'll like if a woman's had a kidney stone, most of them will be like, yeah, that hurt worse than period cramps. If they broke their arm or something like that. So there are these types of acute pain that are definitely more painful than period cramps. And that's not just male, female exclusive. There's women who experience more pain than that before, depending on what's happened in their lives. And there are men where you could probably say that time where they got kicked in the testicles, or that acute phase of pain could have been on a higher intensity level during that moment than, say, another female's period cramps. Again, pain is subjective. It's hard to be like, okay, your pain was worse than their pain. And so I always make it a point not to compare. So how I answer that again is that the intensity of period cramps varies among women. The intensity of pain testicular pain has varied among men. But you'd have to logically say that there are incidents where getting kicked in the testicles or testicular torsion. For testicular torsions, when you look at a man with testicular torsion, you're like, this dude's in pain. Where you could say that there are incidents where testicular pain could be higher or worse than uterine pain. And vice versa. If you got maybe a light kick to the testicle, like, I don't know why I'm talking about getting kicked in the testicles. That's just what men always use. I'm sorry. And so hopefully that makes sense to what I'm getting at here. Again, it's very challenging to compare. What I think is unique about period cramps, though, is the anticipation. There's no dude that's anticipating getting kicked in the nuts every 28 days for 3 days in a row. Or, I mean, and it's still just not a good comparison. But I hope, because the uterine cramps are unique, but I hope that kind of gives you an idea of what I'm getting at. It's a fun topic that you have fun with your friends talking about, and the women usually win because, again, I think what they have on us is the anticipation that it keeps just every month, I'm going to get pain, and we don't, as men, tend to anticipate that. So, I want to thank somebody real quick. I pushed the wrong button on my computer, so give me a second, you guys. I'm sorry. No, don't allow my current location. So I do want to thank Maricela Donnie for a super chat donation. Thanks. That was super nice of you. That helps us kind of keep doing what we're doing here at the Institute of Human Anatomy. We're running out of time, you guys, so I'm going to answer one more question, and then I'll kind of put up our black screen. And anybody who wants to stick around, I will go over the cadaver real quick. And again, you guys, I always feel bad that we can't answer every question because there's so many, but I appreciate that. Hopefully this was informative, but I am going to do one question because I think it's really interesting and it'll lead us into some other things because we still have a lot more to explore in female reproductive anatomy. And for those of you who did not get your questions answered, don't give up on us. Ask us again. You can post it on our accounts and we'll try to answer those questions. But Avon asked, how does cancer work? And I think this applies to the female reproductive system as well, because you've heard of uterine cancer and ovarian cancer. And we have an ovary in our lab that's diseased that we'll be showing here soon. I think we can do that our next live stream. But the cancer is really unique because cancer is the best disguise for an illness, because when you guys get a disease, whether it's COVID-19, whether it's strep throat, whether it's the flu or some other respiratory tract infection, these are recognized as foreign invaders because the surface markers on the outside of these invaders are different than your own cells. So on the outside of all of your cells, like Jonathan's cells or your cells, you have little antigens that are essentially saying, I'm supposed to be here. So I always call them like little ID badges. Like your outside of your cells have little ID badges that they flash to your white blood cells circulating around. Don't kill me, I'm supposed to be here. Because your white blood cells are going to attack anything that looks foreign. And the reason why cancer is such a problem is because it's your own cells. And so it's your own cells dividing out of control. And so then you talk about, okay, how does your immune system recognize that? And in some cases, you do have white blood cells that recognize tumor cells to a certain degree. Obviously, when people get a diagnosis of cancer, the tumor cells disguise themselves, I guess you could say, well enough to continue to divide, and your white blood cells don't kill them. So that's this really, really good disguise in a bad way for our bodies, because these cells can grow out of control, form masses, and your white blood cells are like, you're supposed to be here because you have your ID badges. And that makes something super tricky in cancer treatment. How do you create a drug that will target your cancer cells but not your healthy cells? We do that with other things. We can target bacteria with antibiotics, and those antibiotics are selective enough that they'll just kill the bacteria, but they won't kill your own cells. And so chemotherapy is a big challenge. You give people these chemicals, and there's so many side effects because it also kills healthy cells. I feel like that's kind of the billion-dollar question. As we get better at molecular biology and recognizing variations in cancer cells, again, that is the billion-dollar question. If you can create a drug that can target just a cancer cell and leave your other cells, that would be absolutely huge. And that's a lot of what cancer research goes into. Can we find markers on these cancer cells that aren't on other healthy cells that we could target with a certain drug that would select just for that type of a cell? That would be amazing. And I think, I won't be surprised, in my lifetime if we figure that stuff out and get closer and closer. I don't do a ton of cancer research. I just teach about the pathology of it in pathology classes, but that's an interesting thing. But one of the things that chemo drugs do is they do attack cells that divide quickly, which are cancer cells. They divide quickly, but what other cells divide quickly? Hair cells, skin cells. So it tends to target those too. So you'll see people lose their hair. You'll see people get sores on their skin and things of that nature. From Steve, how is COVID-19 showing up in newborns? That's a pretty good question. From the data that I've researched mostly recently, COVID-19 in children, newborns, or actually it wasn't just newborns, it was below the age of 12 months, only made up about 7% of the cases of children, which is, I think, defined under the age of 18 or 20. And most of the symptoms are similar to other infections. So in the actual data that I was reading, it literally said for the age group below 12 months, and that would include the infants and newborns, said these symptoms are similar to other coronaviruses and influenza viruses, and that the respiratory symptoms can be minimal in most cases with the children. So minimal cough. With kids, it's hard to know at that age, but typically when they're that young, they were discussing fever was one of the main symptoms that they had, as well as feeding difficulties. They just didn't feel like eating as much. And so that's kind of a common symptom of illnesses when newborns and young kids that are breastfeeding get an illness. They don't like to eat as much. They have feeding difficulties and a fever. But they did mention, again, pretty minimal respiratory symptoms. But thanks for your super chat. If you have some other questions on that, post it on we have a comment section or where we do posts on our YouTube channel. If you guys want to address anything there that we didn't address here, you're more than welcome to go there and check it out. But we have, as many of you are waiting for me to do this, a cavity that we're going to take a look at here. So this is the pelvic cavity down here that you can see, and this is taking us into the uterus here. So I'm going to keep my glove out of there because our autofocus does weird things with our gloves here. But this is the top of the uterus. Now we see that in the reproductive video, and if I pull my fingers in there, you can see not a very big structure here, but it's pretty amazing to think about here. So through this area, can you guys see that tissue here? I'm going to bring the camera in there. So if you can see this tissue here, this is called the broad ligament of the uterus. If you see all the lining that's lining the pelvic cavity, all this kind of glossy tissue here, this is called the peritoneal sac. And what happens is it essentially drapes down over on both sides of the uterine tube here and the ligament of the uterus here. But I'm going to pull up the ovary here if I let that slide back. And the ovary likes to hide out behind here. So here is the actual ovary here, about the size of a almond. And when we talked about ovulation, the egg would literally rupture out of the ovary, and this thing, which these little flower or finger-like projections, are little fimbriae that will actually pull the egg into the uterine tube here. Now the uterine tube you have to kind of tease out of this tissue here because it's embedded in there, but I'm tracing it right there in this tissue, and I can kind of feel it with my fingers as I'm rubbing it right there, and hopefully you guys can kind of see it poking through right there in this tissue. Now fertilization typically takes place somewhere in this tube. So the sperm cells make it all the way into the uterine tube, fertilize the egg, and then that fertilized egg should descend down into the inside of the uterus and implant into the wall there. It's pretty remarkable to think about just the size of this structure and how big it can actually get to grow and a baby develop inside there. But if you guys see this ligament right here, some people will have round ligament pain. I don't know if you guys can see that tissue kind of coming out through there. You have to look really closely. I'll trace it with the tip of the probe. Right there. That's the round ligament of the uterus. Some women will get pain in that ligament called the round ligament of the uterus. But pretty amazing structure here. Obviously, this is where we all hailed from. We were in this little cocoon of love here. And so it's pretty, again, amazing to think about this structure here. So hopefully that was worth it to kind of take a look in there. If you guys have any last questions on there, I'll kind of look at the chat here real fast and just scroll to the bottom. But thank you a lot for participating. Let me pull this down here. What are those little balls on the uterus to the right? Oh, we of course need to address that. I'm going to address that. We get that asked all the time. I'm assuming you're talking about these little guys. So what's interesting about this is when some people see this, they almost feel like this is asymmetrical, like the uterus is shifted over to the right side. It's actually pretty well in the center here. What's getting in the way here is the sigmoid colon. So this is the very end of your colon right here. And these little guys are little fatty appendages that are normal that come off of the colon here. If we were to reflect that out of the way, you can get to other uterine structures there, and the ovary would be on that other side. You're starting to see those structures move over to the other side there. So, again, you guys, thanks for watching. I'm going to go to my face here. We're getting better and better at these live streams, hopefully. Justin and I are working on moderating them a little bit more effectively for you guys, so it's a little bit more smooth transition. We are not technology people. We are anatomy people, but we are learning the technology to help you guys see this stuff from wherever you are in the world. So thanks again for joining. We'll do another live stream next week, and keep an eye out for future videos to continue to drop to our YouTube channel. So we'll see you guys.